Good afternoon, everyone. Welcome to today's webinar, Supervision to Promote Family-Driven Practice. We are very excited to have folks join us for this offering. As we give time for folks to just log in, it would be great to just kind of get an idea of who's joining us. So if you could please chat in, your name and your role, organization, just so we kind of, again, have a sense of who's joining us. We are very excited for our presentation today, but before we get started, I just want to orient folks a little bit so you know how to participate in today's offering. Upon joining, you have been placed on mute just to avoid any background noises for folks that might be listening in the background. If at any point you have any technical issues, please chat into the McSilver host who will be able to assist you with that. There will be a section for Q&A at the very end, but we encourage you at any point in time just to put in your chat questions and we'll definitely address them at a later point in time. The recording, the slides, and the tools for today's webinar will be up on the website in 2 to 3 business days, but there are some tools that are actually available on the CTAC website, and we'll refer to those and just let you know where they are later on in our presentation. So for today's offering, Supervision to Promote Family-Driven Practice, again, we are very excited. This topic actually came from feedback of CTAC audience members. So we've had a couple of previous offerings attending to family-driven care, how to really encourage that. Are there any tools and resources, any best practices, any strategies to really work with the family in a very collaborative, transparent manner? But what we heard from providers out in the field is that there seemed to be a lack of support for those doing the work when they were meeting with supervisors. So this is our attempt to really attend to that. For today's presentation, we'll go over some different components, but we'll also highlight a tool that we created that you as supervisors can utilize in supervision with your supervisees. So again, this webinar is for supervisors. However, if you are not a supervisor, we certainly encourage you to continue watching this webinar, but also download the resources. There are resources that are available and helpful for providers themselves, also for families. And again, if you're not a supervisor, you can download the tool or just share it with your supervisor, right? So that they can also utilize it and really promote family-driven practice and be able to support the providers that are doing this work when working with children and families. So we are joined by a couple of folks today. As you hear different voices, they will introduce themselves. My name is Diana Arias. I am a social worker here with CTAC. I'm going to be opening and closing us up, and you'll hear my voice throughout. But very excited again to have you all join us and some of our additional team members. So at this point, I'm just going to orient everyone to today's agenda. We're going to start off with an overview of family-driven care. We'll spend a little bit of time on the supervision core components. We'll introduce the tool that I mentioned, Supervision Strategies to Promote Family-Driven Practice. And then we'll do a little bit of a demonstration on how to actually use this tool in your supervisory meetings with supervisees. And we'll do this through a scenario. So we certainly encourage you to participate via chat. And again, we'll leave any questions towards the end for Q&A. So at this point, I'm going to turn it over to my colleague, Ann Cuppinger.
Good morning, everyone. I'm Ann Cuppinger. I'm with the Community Technical Assistance Center, where I think a lot about family-driven practice in all of the work that we do and how can we really connect differently with the families that we're working with. I also am fortunate that part of my role is to really support the work of family and youth peer advocates. And while anyone can practice in a family-driven manner, sometimes connecting families with family peer advocates is also a really helpful way to support parents to have more of a role and a stronger voice in making decisions that impact their family. So, we like to say if it's about families, it has to be with families and with children and youth as well. So that's kind of the motto around family-driven practice. And the other thing I would say is that, at some level, this gets very simple if you think about what you would want if you were receiving services for your own child or your own family. And when you think about it that way, and you as supervisors, when you are working with your staff to encourage them to work differently with families, all of those things that come into our minds about why it's hard to let this particular family have more of a voice or how that is challenging, Sometimes we can push through that if we really continue to concentrate on the goal, which is really what we would want if we were receiving services. And that is to not just have people making decisions on our behalf, but for us to be really involved in that conversation. So just sort of keep that in mind as we go through here. Family-driven care is a concept that's been discussed for a long time, and it's not different in many ways from person-centered care or a youth-guided practice. But there is a national kind of consensus definition that's evolved over time, and anyone who's done work in system of care projects has probably seen this. The Federation of Families for Children's Mental Health sort of, started this conversation and has been the guardian of the definition for a while as it has evolved. But what family-driven practice means is that families have a primary role in decisions regarding their children, as well as policies and procedures governing the agencies that they receive services from, decisions that are made at the state level. So family-driven really should be something that we keep in mind at all levels, from the interactions that families have with providers, all the way through organizational governance, and then, policies and practices that are decided at other levels outside of an agency. So, obviously here, your primary focus is going to be on encouraging family-driven practice at that provider level. But I would also say, and doing that, you're going to make sure that families are provided with information to support shared decision-making. If people don't have information, if they don't understand, sort of how the services that you provide are going to play out, or if they have options about the kinds of, the way that you might be going to work with them, they can't possibly participate in shared decision-making because they're coming to the table without adequate information. You want families to be able to define who they consider to be family, so that they have the kind of supports around them that they need to be successful. While family-driven practice is not the same thing as family peer support, anytime you can connect a parent or a caregiver to a peer, that person considers it a very central part of their job to support the family to step up and take a bigger role in advocating for their family, in learning about how the system works, so that they can come to the table prepared and empowered and comfortable participating in shared decision-making. Because, sometimes reluctant and afraid families, maybe families who've had a bad experience in the past using their voice, sometimes they actually are a barrier to shared decision-making, because they're kind of taking a protective, self-protective, hands-off approach. But you as a supervisor may also have to do some managing up in this situation. So it's hard for you to get your staff to really practice in a family-driven way if there are policies in place at the organization level that interfere with that. And just a quick example would be that, you might be under pressure to make sure that all of your staff complete an evaluation within the first 3 visits, let's say. And your staff is saying to you, for me to really listen to this family and for us to let this conversation unfold in a manner that makes the family feel comfortable working with me to establish a treatment plan, it's going to take longer than, the 3 visits. And so you may have to then work with the rest of the organization to try to bring the practices into alignment with what you need. So I just want to talk about some common misconceptions about the definition of family-driven care, because these can get in the way. There's a lot of mythology out there. So, sometimes we have to do some myth busting. So family-driven care does not mean that there is a reduced focus on goals and outcomes. You need goals. Families actually want the service to be effective. They don't want to be in care forever. It's really about how you come up with those goals and how you make sure that those goals are something that the family values. Because let's face it, if they don't value it, you're going to be, swimming upstream the whole time. So how do you have that conversation so that the treatment plan means something to the family, that it sounds like something the family would say, so that they can be bought into that whole idea and shape the plan? It doesn't mean that families can demand what they want. It does mean that families should feel comfortable coming to you and saying, this isn't working for me, or I thought this would work, but I have this other idea. Can we explore that? But it's not meant to be a power struggle. It's meant to be more about power sharing. Family-driven care doesn't mean that families are responsible for implementing their own plan of care. There are people that say, great, well, you go figure out what you need. And that's obviously not what this is about. And it doesn't mean that you need to keep your opinions to yourself. It's just that you will bring your professional expertise to the table and invite the family to bring their expertise to the table as well, so that you can come up with a plan that is a partnership. It ultimately doesn't necessarily have to slow things down, although you might have to take a little bit of a slower approach in the beginning. But ultimately, if you really have done a good job engaging the family and being more family driven, you probably will have better outcomes, and in the long run, maybe even be able to be more efficient with how you provide care. And there's nothing about family driven that's to suggest that your clinical expertise is any less valued. So the last thing I'll say before I hand this over to Nicole is that, we talk about this not because it's a nice thing to do, although I do think it's respectful, and I think that it will feel better and be more engaging for families. But we talk about family-driven practice because it leads to better outcomes. Families, it tends to reduce stigma. Families feel valued. It allows us to incorporate the family's understanding and expertise on their own culture, their own family culture, their own culture at large to the table. And so you're adding resources and options to your approach to treatment. And it really gives you the kind of feedback, if you've established that kind of relationship that you need, it gives you the feedback that you need to adjust your plan to help everybody move forward and accomplish their goals. So I'm going to turn it over to Nicole, and she's going to talk a little bit about, I don't know what's happening there. The slides are...
I jumped ahead, sorry.
Oh, you jumped ahead. Okay,
yeah, sorry.
Great. So go ahead, Nicole.
Thank you, Anne. Good afternoon or good morning, depending on where you are. Nice to see you all here. I'm Nicole Lee. I'm a clinical social worker in practice, and I get to partner with this amazing team and contribute to some of these projects. So I'm really excited to be here to talk about supervision and what that looks like with family-driven care. Anne's done a beautiful job summarizing family-driven care, and now to kind of bridge that to what family-driven practice can look like within supervision, we're going to do a brief review of supervision core competencies, which will include the domains of supervision and supervisory best practices. So before diving in, we want to emphasize that there is definitely a parallel between the family-driven care framework between you and your supervisee and the family, and the supervision you as a supervisor will provide to your supervisee. So we want to just make sure that we're going to be emphasizing that parallel. So centering the supervisee's expertise and trusting their assessment in the supervisory dynamic is a parallel to the practice at the center of family-driven care, which is centering the family and their experience and their expertise. So to talk about the three domains of supervision, as you all know, as supervisors within this field, there are many interconnected functions and responsibilities, all of which culminate in ensuring that clients are protected and provided with competent, ethical, and appropriate services. So one approach in thinking about the various functions of a supervisor, we actually borrowed from the NASW's best practice standards in social work supervision, which breaks down supervision into three realms. Sorry about that. There is the first bucket, the first realm we're going to think about is administrative, which we can kind of imagine as some of the organizational or agency specific requirements within the work, which Anne alluded to earlier, with things around evaluations that have to be completed within a first certain number of sessions, or timeframes around documentation. So that's something that is a part of the administrative role of supervision in this field. The second kind of realm is educational, which we can imagine as the work to develop skills and train supervisees in the areas of needed growth to fulfill their role. So that could be training around assessing or intervening or evaluating, and also managing ethical dilemmas that come up. The final realm that we want to reference is the supportive domain. And that we can think about as the holding environment that we as supervisors create to promote safety and trust so that the folks that we are supervising can continue developing their own professional identity. So some best practices that are also, they also come out of the NASW supervisory best practices kind of framework. We want to think about these 4 buckets. It's going to go into 2 slides around creating safety, trust, and collaborative support, which we can break down and we're going to talk about more as we talk about the tool that's coming up. But we want to really define and have a working definition of what support looks like for both individuals, you as a supervisor and the supervisee. You want to work together to establish what the expectations are for the supervisory relationship and walk into the relationship assuming shared best interests and working from a strengths perspective. You want to also think about identifying responsibility and roles and modeling respect in each person's respective roles. So defining expectations within each of your positions, being consistent and being accountable. So having regular meetings, following up as you've said you would, sharing agendas so that you can work on what you want to together and in a collaborative way, and respecting the boundaries of your role and the potential of your supervisee. The other realms we want to put out there to bridge family-driven care to the supervisory kind of perspective is thinking about strengths and resilience through feedback and reflection. So really trying to encourage feedback as a bi-directional process so that you can give feedback and also receive feedback so that both parties are learning. Also encouraging a growth mindset, thinking about the idea of what do I get to learn from this experience, and acknowledging skills to be developed. So normalizing that you don't know everything as a supervisor and your supervisee also doesn't know everything. And so working together on areas both parties can really grow and improve. And finally, thinking through how to really empathize and empower through empathy and also center power sharing. So in supervision, really validating your supervisee's opinions and thoughts, even if you have a different idea or a different approach. Validating does not necessarily mean agreeing, but definitely acknowledging and reflecting back what you're hearing. You want to also explore how experiences can inform the work and other perspectives to consider. So creating a space that allows your supervisee to bring in what their experiences have been and how that might, create a direction that they want to go, and make space for you to also do the same. And as much as possible, encourage shared decision-making whenever there's an opportunity where there gets to be a collaboration through what's going to happen next, making sure that both people and supervisee especially gets a chance to be part of that decision. And now we'll throw it to, I think, Diana.
It's actually me.
Jackie, sorry, thank you.
Yes, no worries. Thank you so much, Nicole. And I'm just going to build on what Nicole just said. And we're going to take it over now to look at this tool that we have developed. Again, Diana referenced this in the beginning. And as she said, that was today's presentation, and this tool came out of work that we have done with providers, learning communities, feedback from people on the ground, and that what we had heard, that there was this need for increased support for supervisors in terms of promoting and actualizing FDC with their staff. So it's this supervision strategies to promote family-driven practice. I believe that the link to this has been just, thank you so much. Kiara just put that in the chat, so you can see the link there to access the tool yourself. It is a tool, again, that goes through these different principles, strategies of family-driven practice that are in line with those guiding principles of family-driven care. And then you'll see for each one, there's these sort of 2 sections under each. You have ways that the supervisor can model those strategies in the supervision space, and then also questions that you can ask of your supervisees in order to promote it with their practice. And it really gets at that sort of parallel practice that Nicole was just talking about. So I'm actually going to share my screen and we can go through the tool together. So let me just do that real quick. Here we go. Okay. So as you can see, again, we have these 4 strategies, and for each one you have ways to model it, and then questions that you can use to promote within the supervision space. So this first first strategy here is creating safety, trust, and collaboration. It gives some detail under it. That means sort of what that sort of can look like. It means fostering trust, communication, and collaboration via a secure and safe environment that allows all to do their best work together. And this means keeping in mind physical, emotional, and cultural safety. So Nicole actually just mentioned some of the ways that we can do this. She mentioned being consistent and predictable. That might mean having supervision at the same time every week, but also it means setting an agenda. And you can see that under these ways you can model here is being sort of setting agenda and having sort of that predictability. And again, you get that parallel process in the question that you can use with your supervisee to then have them promote family-driven care with the families they're working with. And you might ask them something like, how is the agenda for your meetings co-created with the family so that the family knows what to expect? So again, you sort of have that parallel process. The second strategy is identifying responsibility and roles and then modeling respect. So this means being clear about roles and responsibilities, showing respect and that you care. And that also means honoring each person's values, culture, and contributions. This means keeping in mind compassion, valuing expertise, honesty, and cultural humility. Nicole also just referenced this when she talked about, being validating, even if you don't always agree. Another way that you can model this is by discussing expectations and boundaries regarding your professional relationship with your supervisee. So what does it mean to be a supervisor, right? You're going to be talking about people's own reactions, but what does that mean in terms of a professional relationship? And so that's one way that you can actualize this strategy in terms of modeling it. And then similarly, one thing you can ask of your supervisees is, how are they asking about priorities with the family? So that you can see the question there. In which way do you and the parent agree/disagree about priorities, how to work together, and how to address concerns? The third strategy we have is focusing on strengths and resilience through feedback and reflection. This means cultivating a culture that continuously builds capacity, affirms efforts to grow. It means building on that positive, celebrating progress, looking for assets. So one way that you can do this is in terms of modeling. Let me see where it is asking about needed resources and supporting supervisees in achieving their professional and personal goals. So it means, what are those personal goals? And maybe those are strengths that you bring into your work. And then again, a question you can ask of your supervisees so that they can do this with the families is, how have you helped to increase the family's support resources? So connected that, sorry, that was the next one, sorry. What does you and the family identify as goals? And what is the family assessment of progress toward those goals, right? So it's, again, you're helping the supervisee to identify their goals and modeling that in supervision, and then you're asking them about how they are replicating that in their work with the family. This last one is empowerment through empathy and power sharing. So this means creating an environment which fosters choice, partnership, and equity. It means keeping in mind collaboration, shared decision-making, transparency, empathetic connection, shared understanding, and mutual accountability. So a way that you can model this approach is by fostering connections amongst your supervisees. So connecting supervisees to their coworkers in order to have them have added support. So you can see that last one there. And then similarly, as I was just saying, you can encourage the supervisee to do the same for the family by asking the question, how have you helped to increase the family support resources? For example, connecting them to a family peer. So you can see for each of these, there are these sort of parallel processes. You're looking to model these things in the supervision space and then also ask the supervisee about how they are actualizing it with the family. So I'm going to stop sharing now and we're going to go back to the slides. Fantastic. Thanks so much, Diana. So that's just a brief overview of the tool. And if questions are coming up for folks about the tool, about how you use it, please feel free to throw those in the chat. We're going to have time to answer questions at the end. And again, this is not a script for supervision. It is not things that you have to do, but it's a guide, a place to get you started in actualizing and sort of promoting family-driven care, family-driven practice with your supervisees. Another way that you can do that is sort of on a larger programmatic level. We know that a lot of folks that supervise, you often are supervising multiple people, and you also are often thinking sort of programmatically, what can I do to enhance family-driven care amongst all of my supervisees, amongst the program in general. And so these are some sort of those higher level strategies, the more macro or meso level strategies. Some of these might be involving family members with lived experience in day-to-day aspects of the organization. So that might mean making sure that you're hiring from the community, bringing in folks to be co-trainers, having them included on interview committees, or just doing community outreach, or having people do walkthroughs of the agency. It means also reaching out, above, right, as well, engaging your leadership, program managers, board of directors early and often to make sure that there's an understanding of what is going on the ground. So there's sort of that through line that everyone sort of has that connection and is understanding how family-driven practice is being woven into all aspects of the organization. It might mean developing a process for obtaining and acting on family feedback. So maybe you decide to do an annual survey. Maybe you decide to take the survey you're already doing and to develop new ways of integrating that feedback into your practice and into the program. It might mean involving family leaders and decision-making bodies. So that might be having like an advisory board or involving them in evaluation, again, in hiring. It might mean that you look at your program policies and procedures through the lens of family-driven care. So what does it mean? How are we doing our intakes? How are we doing, how is our program functioning? And is that reflective of family-driven care? And then also it really means integrating those family and youth peer advocates into all of the teams, because we know that they are such an invaluable, they bring such an invaluable perspective, and they really are supporting that family and youth voice. So you all may have the ability to do some of these things. You may have the ability to do all of these things, but it's about figuring out where you do have agency to change things on sort of those higher level in order to maybe promote family-driven care across your program. And I am now going to hand it over to Diana. Great.
Thanks, Jackie. So I know that that's a lot of information. I know Anne was talking about the guiding principles. Nicole and Jackie were just going over the tool. So those links are available if there's any difficulties. And I did see that some folks were having difficulties. It's also available on our larger CTAC webpage under the tools tab. So I also just wanted to share this tool as well. So we created an additional tool, tips for partnering with a child service provider. So Nicole was talking about, those sort of core competencies, and this really aligns with empowerment through empathy and power sharing. And really it's a way of building that therapeutic relationship, but also promoting mutual accountability. So this particular tool, while it is tips for partnering for your child service provider, right? It's something for the family, something for the caregiver that a provider might share. It's also a way of modeling what this looks like and bringing it into that conversation, right? So you as a supervisor can introduce this tool to the people that you're supervising, to the people that are doing that work on the ground. So the guide was, as I said, designed for parents and caregivers, but to really help them understand their role in family-driven partnership and how much of their active involvement can really help their child have positive outcomes. But as I said, the partnership really needs to be understood, but also encouraged by those providing the services. So you as a supervisor can review the tool, go over any questions or concerns that they might have. So you're really, again, modeling, right? Really talking about that parallel process that Nicole mentioned, right? Bringing that tool in. How do you talk about this tool? How do you introduce this tool? Are there any questions? Are there any concerns? Have you partnered, right? Let's think about asking the family how they've partnered with providers in the past. Maybe they haven't, right? And this is a way of really encouraging them and empowering them as well. Maybe they have tried to partner, but that communication or that effort was, maybe didn't end in the best possible way. And that's unfortunately sort of left a bad taste for families. And now maybe they don't even try, right? Because they haven't been encouraged or they had a bad experience. So again, this is a way of holding yourself accountable. This is what it means. This is how I, as a provider, am going to be here for you and your family. I want you to know that. And these are some tips that you can help me as well. So it's that collaborative relationship. But again, the supervisor can bring this tool into families. I believe the link should also be in your chat box. Again, if not, as I said, it's available on our website under the tools tab. And this particular tool, as well as the guiding principles, are available in Spanish. Unfortunately, the supervisory strategies is only available in English at this particular moment in time. But this is, again, another tool just to help you as a supervisor to really bring in tools so that you can support your supervisees in promoting family-driven care. I also want to highlight some additional resources that we have at CTAC. So, our website, ctacny.org, you can go and you can use our search bar and you'll come up with webinars, obviously tools, which is what we're highlighting today. But I did want to take the time just to sort of highlight that there are also self-paced learning modules that you can share with your supervisees, but also for your own understanding as well and your own knowledge base so that you can be well informed better informed as you're having supervisory meetings with those that you supervise. So some of the examples that we have here are family engagement, best practices in supervision, family-driven care, and trauma-informed care, right? So we're talking about the framework of family-driven care, but it also aligns with being trauma-informed. It also aligns with being youth-guided. So these are some of the things that we also have and that we encourage you to take advantage of on our website. And these particular modules you can access through the LMS site, which is the Learning Management System. That's the lms.ctacny.org. Or you can also go into our overall webpage, use the search bar, as I mentioned, type in family-driven care, and our resources, webinars, and modules will come up. But I did want to highlight these as they are another source of support for you as a supervisor as you continue to promote family-driven practice with your supervisees. And with that, I'm going to turn it over to Nicole, who's really going to try to bring the tool to life. Because again, I do understand that it is a lot of information, and we're hoping that you're kind of going through the tool right now. But we're going to carve a little bit of time just again to sort of demonstrate how to use that. So Nicole.
Thank you, Diana. All right, so we're going to have a couple demonstrations or scenarios to work through together using the tool. I want to remind you all to put on your supervisor hat when you're hearing the information and how we can use the tool in supervision with your supervisee to promote a family-driven practice. And if you can have the tool pulled up, that would be ideal, just so you can kind of see and follow along with how we're trying to encourage you guys to use it. All right, so for the first scenario, I'll let Diana go ahead and read that.
Sure. So for scenario number one, you again as a supervisor. So your supervisee is working with a parent, Mike, and his child, MJ. Due to ongoing concern of the child's continued struggles with outbursts in school and home, the school-based support team met with the parent and your supervisee to update the child's behavioral support plan. In supervision, your supervisee shared the following update on the meeting. The parent took time off from work to attend, as the meeting was held at the end of the school day, but in the middle of his working shift. After everyone present had shared their concerns, the school psychologist shared a possible solution, which the other school staff agreed with, and quickly brought the meeting to a close in less than 15 minutes. When walking out of the school, the parent shared with the supervisee that he doesn't think the solution will work for their child.
Thanks, Diana. So I'm wondering, for everyone here with their supervisor hat on, what stands out to you in this scenario? You can chat in. What stands out to you in this situation? Any reactions? Any initial thoughts? And I know it's a lot of information. We've thrown a lot at you all. So reread it, take a look, and let us know any initial thoughts. Dad's thoughts. Yes, that's question mark. Absolutely. What are dad's thoughts? We don't know. The parent was able to share his feelings. Yes. No opinion received from the parent. Exactly. Not accommodating. Yeah. Thank you, Denise. Parent took off of work and it was only 15 minutes. Parent didn't get a voice to voice their opinion on when the meeting would take place or about the plan, and they rushed. Yes. Thank you all. So thinking about the tool and family-driven care as the approach, what next steps would you as a supervisor take with your supervisee? What might you do next to really try to promote family-driven practice in the supervision? And you're in your regularly scheduled supervision hour. They just sent just have this recap. You're having these reactions like, oh my gosh, this sounds rushed. Oh my gosh, the parent didn't get a chance to talk. So Amber, yes, have the supervisee talk to dad and get his input. See if dad wants to meet with school again to advocate for his son's needs and what works with him. Have the supervisee schedule a meeting with the parent to go over all of his concerns, develop a plan on how to address them with the school. Excellent. So we're going right into problem solving as supervisors. I'm wondering, okay, Colette, exactly. We're getting it right on the nose here. Is the supervisee frustrated? What's the parallel here? What's happening in parallel for the parent and maybe for the supervisee you're meeting with? Lydia, explore the dad's feelings and discuss how he would like to go forward. Thinking about the parallel process, Sarah. Yes. What was it like for the supervisee? So I'm wondering what you all would do. What question might you ask the supervisee specifically? What might you ask? You can look at the family-driven care supervision tool. There's some model questions you can pose. And Denise, you added in supervisee, be curious with dad on how he could have more of a voice. So, right, okay. And what you also want to think about the areas of best practice for supervision. So are we focusing on creating safety, trust, and collaboration? Are we focusing on strengths and resilience? But what questions specifically might you ask your supervisee to help them center family-driven practice? And I think someone, oh, Marissa, thank you. Are there any frustrations that you had with the meeting that could be similar to dad's? Nice. What does dad need first? Colette says, no worries, Doris. Thanks, glad you're back. Great. So if we're looking at the tool, which hopefully you all have up, yeah, looking at creating safety, trust, and collaboration, thinking about the agenda for the meeting. How was the agenda set? Asking them how they could go back to the team and talk about the agenda. Another category we could think about is identifying roles, modeling respect, and that question that's kind of towards the end of the promote column of how have you encouraged the parent to give their honest opinion about the meeting, and how can I support you in this process? Ask what the dad, you got that one. Okay, beautiful. Thank you, everyone, for chatting in. All right, we're going to move to the next scenario. Oh, Kathleen, how can you work with dad to identify strengths within the family to promote advocacy? Beautiful. Thank you, Kathleen. Yeah, and so as you all can see with the tool, there's a lot of, none of this is rigid. There's lots of areas that can support another area, and you guys are hitting on that, where there's lots of different places to start and ways to center the family-driven practice as you're providing supervision. Great. All right, so again, supervisor hat remains on. I'll let Diana read this next scenario.
Great, thank you. So for scenario number 2, in supervision with your supervisee, they share the information below after completing an intake session. Ms. Bruno, a single parent of 5 children, was referred by the school principal due to her middle child, Stephen's difficulty focusing in class. Ms. Bruno shared that she is most concerned with managing her two eldest children and often feels like she does not have the bandwidth to focus on her younger children. In exploring her goals for therapy for her middle child, she continued to focus on her two oldest children. Your supervisee shares the child's presenting symptoms of irritability, ants in the pants, frequently losing things, and having difficulty staying focused on tasks in home and school, and suggests the child be seen for individual therapy.
Thanks, Diana. All right, so again, any initial reactions, any initial thoughts as a supervisor to this summary that your supervisee provided? Parent sounds very overwhelmed. Thank you, Marissa. Yes. I would also be curious about what's going on with the older kids because it's getting in the way. Yeah, it's taking up space in this intake. Exactly. How can we support mom so she can support her son? Mom needs support here. She's feeling overwhelmed. Doris says initial thought was, has the worker been in touch with the school? Great. Thank you for those initial thoughts. So now moving towards the tool and thinking about those core competencies in supervision or as a supervisor, what next steps might you take as a supervisor to just center family-driven care? So Carmen, you're going into the support piece. Yes, find out if mom has support outside of the worker. What might you do as a supervisor in supervision to bring this back in a parallel way to family-driven practice? And we can jump to the next question, which also centers, oh, Marissa, thank you. Help supervisee develop empathy around mom's situation. Right. Yeah, and I think something that stood out to me about this scenario is that the supervisees stay focused on individual therapy as the child referred. But as you all picked up on, mom is really overwhelmed with the oldest and mom needs support and she's overwhelmed. And so Colette, you mentioned support supervisee in determining strategies that work for mom. So what could work for mom? Yeah, absolutely. Kathy, you mentioned talk to the family about adding a family peer advocate to provide support to mom. And inquire with mom on what changes she might want in place to address the concerns brought about for the middle child. Yes. So, and I want to think about other treatment options or other ways to center family-driven care. If mom's coming in with the older children kind of at the top of her priority list, even though the middle child's been referred, how do we look at the whole picture here of what's happening with this family? And so in the last category of this, the family-driven care supervision tool, thinking about empowerment through empathy. And I know someone else mentioned empathy in the chat and power sharing, so this referral came through from an outside a school person, school staff member. But mom's really focused on the older kids. So how can we really center and make mom understand that she has say as well about how she's asking and receiving support and how she's partnering with your supervisee? And Kathy says, listen to mom, ask mom what she needs. Do any of the questions in the tool stand out to you all as like a way to center family-driven practice? So one that stood out to me was, how will you ensure the family's views are reflected in their assessment, treatment plan, progress notes, and evaluations? So even just starting with the intake, how will you make sure, as in me being a supervisor, asking my supervisee, that the family's views, which mom has said quite a lot about the older children, how are we going to make sure her priorities are reflected in the treatment plans and the next steps for treatment options? And no worry, Danielle, I was figuring it was not a question. Thank you. Okay. Well, thank you all for the chat ins. And I think that brings us to the Q&A.
Yes, thank you so much. So thank you to our team for presenting that information. We do want to open it up for questions. Just as a reminder, if you have any questions, please feel free to chat those in. I'm not really, I don't know if Anne, you're looking at the Q&A, but I also just wanted to bring in our team as well, if there's any additional information along the lines of supervision that we could maybe offer to our audience. Again, as was mentioned earlier, this was really out of feedback and a request from providers saying, hey, you know, we're getting the resources. It would be great if our supervisors had additional resources as well. So just wanted to bring in our team, but also those of you on the line, you know, this is a way of supporting you, but are there other things that you might need to really support you in supporting your supervisees, the people that are, you know, again, doing the work with families and children? So also invite you just to chat in your questions or any additional feedback that you might have for us.
Diana, most of what we see in the chat is really feedback around the scenarios. So, you know, I would encourage people to, you know, just here, while you have this couple of minutes here, stop and think about, as a supervisor, what is it that's hardest about, you know, sort of shifting practice in this way? And I would say that based on some, you know, some of the work we've done, one of the hardest things is that supervisors need to know what they're looking for in terms of practice being family driven. You know, and you don't have to, this is a process, right? So you're taking baby steps to move in this direction. But sometimes we start very fundamentally with how were these, you know, your supervisee comes back, they've got some goals and objectives. And you can even ask the question, you know, how did you come up with these? And sometimes the answer really leads you on a longer conversation. Like they might just say, well, this is what the school wanted us to work on. Or, you know, we talked for half an hour and these seem like, you know, good goals and objectives. You know, when supervision is rushed, as it often is, because I know that there's so little time set aside for supervision, you know, it's easy to say, oh, okay, great. You know, when in fact, some follow-up questions can just encourage your supervisees to think a little bit more deeply. What does the parent think about these goals and objectives? Did you ask the parent what they think about these goals and objectives? When they come back to you in a couple of weeks and say the parent's not doing what they're supposed to do related to these goals and objectives, that's also another opportunity to say, well, how much do they, what's your sense of how much they agree with these goals and objectives? And give me some specific examples about that, because so often treatment plans get developed for and around people rather than really with them. Yeah, and I see Denise is saying, you know, the goals should be from the family. Yeah, so that's, you know, it's, and maybe that was in reference, I don't know if that's in reference to what I just said or in reference to the previous scenario, but it's often not the case, especially if you have families that are, where some external organization is either bothered by what's happening, let's say a school that's worried about a child's behavior, or Child Protective Services that is concerned about child safety. Frequently, things are really taken out of the family's hands. And you can get, oftentimes, so this is a win-win situation here where you can get to the same outcome, but really start what's most concerning for the parent. So let's take that parent with the 5 children. It would be, if the mom's focus is really on the needs of the older 2 children, which she herself recognizes is taking time away from her younger children, including that middle child who the school is worried about, you know, starting work with her around those older children doesn't mean you've ignored the concern about the middle child. It means that you've done you've listened to her about what are her priority concerns. And in the context of that, you've created, I think, goodwill and trust and space to perhaps continue the conversation about the middle child. So I think a lot of this has to do with, how you ask follow-up questions in supervision. And that's why you see in that tool a whole lot of possible questions, not that you're going to depose your staff every time they come back, but they just give you ideas about how you might approach that. So I see Doris is chatting in. One of my challenges during supervision is time constraints. Absolutely. My agency encourages supervision not go beyond an hour, if possible. Sometimes supervision requires more in-depth analysis of what's happening with cases and how the worker needs support. However, I don't want to overwhelm the worker, so it feels rushed. I try to encourage the worker to come prepared with their questions or key concerns they want addressed. But sometimes, even with that, I can't keep it to 1 hour. Yeah.
Yeah, that's so tough, Doris. That's hard. And I can feel the pressure, and I can feel that you're balancing in trying to get to everything. That's that administrative limitation. So thanks for raising that. And I think that's a real life barrier to some of these, but that's why we want to also think, going off of what Anne was saying, is helping our supervisees also start to internalize some of these processes so that they're going in this direction even on their own. So yes, they're bringing these things to you in supervision, but they're also starting to internalize, what does a family-driven care approach look like, because you're modeling it in a parallel way in supervision. But thank you for sharing that's a real barrier.
I have often seen group supervision work really well on some of these issues too. I know that I've been thinking about family-driven practice for a long time, and I still will find myself in situations where I'm not doing direct service work. I'm not under those same time constraints, but I will be having a conversation with someone about a scenario in which a staff person is really struggling, and someone else, there may be 2 or 3 people who are part of that conversation. And by bringing that variety of perspectives into the conversation, sometimes you generate ideas about different ways of working or different ways of looking at the problem. So, you still are doing your 1 hour a week supervision, but maybe you can create an opportunity for some group supervision where you're not trying to accomplish everything during that time, but people can bring a particular challenge to the table and help each other think about it through this lens, and see, what ideas people have, other people have. So it doesn't all come back to you, which is also hard, to be the one that's supposed to be coming up with all the solutions, right?
Yeah, and
Thanks
I was
for that, Anne.
just going to echo that and that really reflects one of the strategies on that tool, which is to connect folks to their peers and have peer support. So if you're not available, which we know that a lot of you all are, you have many supervisees, you have many meetings, that can really help to also, again, disperse that responsibility as well.
Yeah, and I was just going to add, and I think you were just in my head, right? Because I had some of those sort of group supervisions where it's either maybe let's watch a film together and, kind of as we did a scenario here, what stood out, right? And then how can we look at the scenario, whether it's a small scenario, a written one, or a short film? How do we get that family-driven lens, right? And what are some of the things that stood out to you? What was maybe not family-driven? What was maybe family-driven? Can you think of, of a family that maybe is similar in terms of, maybe some of the challenges that are being raised, so that it becomes, even modeling, as you were saying, Anne and Jackie as well, right? Modeling in a larger group setting. And as was highlighted, I believe, by Jackie, right? Also connecting your coworkers or your supervisees to other supervisees, right? Because maybe as a supervisor, you're maybe attending to the same frustration, or maybe there's no time for that supervisee to even voice that frustration or concern or challenge, but their coworker 6 feet away is also feeling that frustration, right? But you may not be aware of that. So it's a way of also connecting supervisees to other coworkers so that there is, again, increasing that sense of support. And then they can also go and take that as it's being modeled and really implementing that in their practice as well, right? How do we connect that family to another family, maybe a family peer advocate, maybe a youth peer advocate. And I know that that was one of the comments that one of the attendees brought up, right, is maybe connecting them to a family peer advocate. So it's always trying to find those ways with all the challenges administratively of how you can create those opportunities. So it's not solely on you as a supervisor, but you're creating that opportunity for collaborative growth and learning and understanding.
It's hard for, workers to hang in there when things are rough. And, sometimes it just takes a little bit, and they want to. Like, I'm talking about staff who want to do the right thing and who want to really get this right, for a particular family. But if it's been frustrating for a while, it can just be kind of, it can be hard to get outside of the situation enough to say, gosh, I wonder if you had tried this or asked this question. I mean, the other thing too, when things aren't working in a family-driven mindset, you're going back to the family and you're being transparent with them. And you're saying, look, I'm feeling frustrated. My guess is that you may be feeling frustrated too, because if you as the worker are frustrated, I can guarantee you the family is frustrated also, or annoyed or something, some kind of thing that's getting in the way. And going back to them and really being honest and saying something's not working here. And I'm absolutely, totally willing to make some changes. But I need some help from you thinking through, and, people may not be able to give you like the answer, but it's a conversation that you can start. That's really important. And I think sometimes that's a simple strategy that we overlook. You haven't been coming. This is everyone's frequent complaint. You haven't been coming regularly, and it's causing me stress because it's not good to have all these quote unquote no-shows. I don't want to make it, I want to be really careful that I don't make assumptions about why that's happening. So here are some reasons. Some people have told me why they don't come, and they range from I have logistical problems to this isn't feeling good to me to I don't like the way you talked to me last week, right? And I really want to know, is there something that I'm doing or something about this work together that's getting in the way? That's a very different conversation than most clinicians will have with folks that they're working with.
Thank you. And I know just in the interest of time, I did see just a question pop up, so hopefully we can get to it. What are examples of some strategies to help the youth become more receptive when you have a supportive family, but a youth that is not as supportive or involved? So how can we work with a youth that's resistant?
I think that when you're thinking about as a supervisor, a lot of the support that you're going to be giving to that staff person is going to be around, I'm speaking from my own experience doing youth work. And I think early on in my career, a lot of the support I was seeking out was around my own frustration and around my own sense of self-doubt. So it's a lot of things as a supervisor, you're going to want to be encouraging your supervisee to continue to engage with the parent, to continue to engage with the school, and then also to be patient with that young person, because you cannot force a young person to be engaged in therapy. They might be forced to come to you. They might be forced to sit in your office. But so a lot of the work in terms of us as a supervisor, I feel like is about helping that supervisee to process what their own frustration is in the room, and then also helping them to think about those engagement strategies. What is going to help that young person to feel empowered in the room to actually utilize that space for what they want to work on? Maybe what their parent or family member wants them to work on and what they think is important are not the same things. Maybe they are I don't think I need therapy. And it's okay, well, what do you want to use this time for? So helping that supervisee feel also permission to think creatively, right? I think about, maybe that supervisee is well, I just want to work on, writing my comic book. Okay, well, maybe we use the space for that. So giving that sort of permission to whatever degree is appropriate, given the role and given the scope, to help them to meet that client where they are. And then also you as the supervisor are meeting them where they are. And again, validating that frustration, validating that feeling of maybe insecurity that this is a young person that maybe doesn't want to be in your office. So I think it's sort of, again, helping you to meet the supervisee where they are so that they can meet the young person and their family where they are.
And some comments, thank you, Jackie. Some comments coming in, definitely just ask the youth, right? As you were just saying, what do they want to work on? And reminding the youth and the family collectively that they have a responsibility in terms of how much and how soon they make any progress when that is determined, right? What the progress is. So great. Just in the interest of time, I do want to thank everyone for joining. I do want to highlight our upcoming events next week, or actually tomorrow and next week. We have one on early onset persistent depressive disorder. That's happening tomorrow. Schema therapy for narcissistic personality disorder. That's happening next week. And again, I do want to thank you. Just as a reminder, the recording and the slides for this webinar will be up on our webpage, ctacny.org, within 2 to 3 business days. However, the tools are available on our webpage under the tools tab, so feel free to visit that. Also for our, visit our website for any additional information, including those modules that I highlighted. And as you close out, you'll have a feedback survey that will pop up. As I said, this topic came out of feedback from audience members. So please, we do look at the feedback and do take it seriously and try to tailor our trainings towards that. And any questions or whatnot that may have come up, please, feel free to contact us. But that's all the time that we have for today. And on behalf of CTAC, we do want to thank you for joining and have a great rest of the day, everyone. Take care.
Thanks, everyone.